Hello friends, this is the picture showing the normal artery. This is the thin intima which is seen here. Okay, this is the thin intima which is seen, and below this is the media which is seen, and here if you see, this is the external elastic lamina. This is media, this is the intima, this is external elastic lamina, and this is the adventitia. So this is the picture of normal artery. This is again the picture showing the normal artery and normal vein. So if you see, in the normal artery we have thin walled intima, and this is the thick walled media, and we have the adventitia. Okay, vein is irregularly, it has irregular shape. Okay, and the media in vein is very less when compared to the artery. So this is the second picture. Now this is the third picture showing the normal arterioles. So this is normal arteriole. Okay, this is the picture showing the vein, venule, not normal vein, it is venule, the branch of vein. Okay, and this is the picture showing the peripheral small nerve. So this is van structure, vein, artery, venule and nerve structures, van structures. So if you see, this is the vessel. In the vessel you can see this streak here. If you see this streak which you can see here, this is called as fatty streak, and it is seen in atherosclerosis. Okay, next picture. Now this is the artery. Most commonly this is the coronary artery, and in the coronary artery here you can see this plaque which you can see here. This is the atheromatous plaque here. Here you can see the atheromatous plaque which is occluding the artery, and this has resulted in narrowing of the lumen also. Right, this is the hemorrhage which you see in the plaque. This is the hemorrhage, focal hemorrhage which you see in the plaque, which is a complication of atherosclerosis. And then this is the next picture which is showing severe aortic atherosclerosis, and the whole intimal surface here. This is the whole intimal surface. Even here, this is the whole intimal surface which is involved in ulceration. This is involved in ulceration of neural thrombi. Okay. So this is ulceration, and this is also atherosclerotic plaque with ulceration. And then the risk factors of atherosclerosis can be hyperlipidemia, diabetes mellitus, smoking, hypertension and obesity also. This is the picture showing atherosclerosis. This is the cross section of aorta, where if you see, this is the intima. Okay, this is the media, complete media, and if you can see here in the intima, there is foam cells are seen with numerous cholesterol clefts. So all these are cholesterol clefts which you can see. See, all these small clefts which you can see are cholesterol clefts, which is a result of breakdown product of lipid imbibed into the foam cells. Okay, so here there is a mural thrombus which has resulted in this advanced atheroma. So this lesion is called as advanced atheroma, which is a part of atherosclerosis. Then the same picture but a magnified picture, where you can see these clefts which are cholesterol clefts. I will show you the previous picture again. In this picture you can see these cleft like spaces right here, and these are nothing but the magnified view of this picture. 1 minute. Magnified view of this picture. This is the cholesterol cleft. Okay, and what is the foam cell? This is a foam cell. This is the foam cell. This is the cholesterol cleft. So this is the picture of aortic atheroma, which is a part of atherosclerosis. So here see, this is the blood vessel. So in this here, this is the complex atherosclerosis which is seen, which is severe degree of coronary artery narrowing. There is coronary artery narrowing. See, this is the artery, but now this artery has been narrowed because of this complex atheroma which is present. So this is atherosclerosis. One more atherosclerosis microscopic view. This is again the microscopic view of atherosclerosis, where this is the cholesterol cleft again, and these are the foam cells which you can see. The same picture, but this picture contains many foam cells and only one cholesterol cleft. All these are foam cells. This is one cholesterol cleft. So this is also an advanced atheroma, a part of atherosclerosis. So if you see here, this is a picture of atherosclerosis which is showing here. This is the artery again. Okay, these are the many cholesterol clefts which you can see in the atherosclerosis. And what is this? This is the blood vessel lumen, but this blood vessel lumen is here filled with thrombus. This is the arterial media which is seen. This is the media. Okay, these are cholesterol clefts which you can see. So this is also a picture of atherosclerosis. Right. So this is the CT scan which is showing atherosclerosis. So here you will see this is the aortic lumen. This aortic lumen has bright attenuation of the blood, and so this bright attenuation of blood is surrounded by this dark lumen. So if you see, it is something like this. Here it is filled with bright attenuation of blood. Surrounding it there is a grayish mural thrombus, right? So this is the thrombus. This surrounding thing is the thrombus, and in the middle we have the blood, right? So if you see here, this surrounding grayish thing is the thrombus, whereas the center here, the bright one is the blood. So this is also a CT scan which is showing atherosclerosis. Thank you for watching.